Welcome to the CCBC Library. It's my privilege to talk to you today, especially during these times when you're going into a field where you should be wearing capes. So thank you again. Today we're going to talk about evidence-based practice, and it's a way that nurses use research to make their practice better. So I'm going to take you through some background information first, but initially here we are at the library, and hopefully soon we'll be back there together, or I'll be seeing you there. In the meantime, we're going to talk again about what you need to know now so you can research remotely and so you can get an A on those assignments. I'm going to take you to a couple places in the library where you can do this research, advise you on what is acceptable out there on the web for nurses, because you have very high standards of what you can use for research. Also, I did want to mention that our services are online, so if you need to chat with me, there's a chat up on the library pages. You can email me. The library voicemails come to my email, so terry.gallagher@ccbc.edu or library@ccbc.edu. Either of those will come to me, and again, we have the live chat during the days when I'm on duty, and then it goes to an away chat. So that's located, I'm going to go right back here. It's located down in the corner, in the corner where this picture is. You'll see chat, and it'll be live, or if it is away, then your question will go again to my email. So we're trying to cover you every way we can. So, and I'd love to hear from you. So anyway, there was one more thing I wanted to mention. As you do your assignments, regardless of the class, remember our online academic coaches are still available. Their schedule is on the website just like they were in the library. So utilize their services, and also supportive services. If you qualify, if you have any kind of special, circumstances that qualify for maybe taking longer on your tests, or if you take a medication, or if you need some special software for trying to learn because you've been diagnosed with some sort of learning issues, please contact our supportive services staff. So we are here for you. So today we're going to talk about evidence-based practice, and I'm going to start out with a story. So here we are at the cyber library. We're going to start out with an evidence-based practice story time. Yes, I did used to do all the children's librarian work at one of my libraries. So anyhow, but this is from a book called Implementing Evidence-Based Practice, and it's Real Life Successes. So the article's title is Mother and Baby Survive Cardiac Arrest Due to Research Study by Lisa Gay, who is college nursing faculty in Indiana. On one Friday the 13th, I learned the importance of evidence-based practice. My pregnant 32-year-old daughter and her husband were attending movie night at their church when she suffered a full arrest. She had no cardiac history and had just been to her prenatal checkup the week before. I had been an OB nurse for several years and had not detected any problems. Thankfully, some of the people at the gathering were trained in CPR. She was taken to one of the few hospitals in the United States that was participating in a research study that used hypothermia protocols on specific full arrest codes. The premise is that reduction of body temperature reduces the flow of toxins to the brain, thereby controlling preserving neurological functions. But problems arose when the hospital personnel realized she was pregnant, because procedure had never been trialed on a pregnant client. Because she was not quite 20 weeks in gestation, it was decided the baby was not viable without the mother, and a very brave emergency room physician opted to include her in the study. Lowering her body temperature worked, and she survived the first 48 hours. Her arrhythmia continued to be a problem, and on her second day on life support, her cardiologist told us she needed to have a defibrillator pacemaker implanted or she would not survive. But she had aspirated and now had pneumonia with the accompanying fever. Thus, she was not a surgical candidate. We prepared for my daughter to die. One nurse caring for her kept muttering that he had read something in one of the nursing journals about an external defibrillator vest that he thought could buy her time until her fever broke. He spent the next few hours scouring the internet for journals to get information on new equipment. At 3 a.m, he exclaimed, "I found it." And without any hesitation, he phoned the cardiologist and awoke him to ask for permission to get the new equipment sent into the hospital. Every nurse knows how daunting it must be to wake a doctor in the wee hours of the morning, much less ask about obtaining an experimental piece of equipment. Well, the doctor ordered the vest. By dawn, a company representative had flown in from out of state, and the cardiologist and I were meeting with him to get our training. And it goes on to say that eventually her fever broke, but without the nurse using his evidence-based practice, we would have not known about the equipment, and she might have died. We will be forever grateful to his dedication and profession and to his patients. I worried about my grandbaby and how much damage we had caused him. He had been oxygen deprived and defibrillated in excess of 20 times. His mother had been without a spontaneous heartbeat for more than 45 minutes. He had been given cardiac medications chilled to the point where we could see him shivering in utero. His unconscious mother was on life support for more than a week. On a warm day in July, our new grandson entered his world. He is perfect in every way. We nicknamed him Zap because he had been defibrillated so many times. He has earned his name because he is one busy guy. Our daughter continued to improve. At one point, she was in the beginning stages of a heart transplant, but this summer she was doing so well, she participated in a walkathon for charity. She has learned more about low-sodium diets than most nurses I know, and continues to be my hero for her fortitude and determination to be a good mother to her children. We have been truly blessed. We had a nurse who followed the nursing journals and paid attention to research. We had doctors at a hospital that participated in a research study that would change our lives forever. And we had the man upstairs who saw fit to let everyone survive intact. But that is not the end of our story. Ironically, I was given a chance to pay it forward when a student in the college where I teach suffered the same type of arrest. I was summoned to the room and performed CPR along with a coworker. The student was given the same hypothermic treatment and survived only 1 month later. She had already returned to her job, and next month she plans to re-enroll in her classes and finish our nursing program. Now that's the end, or is it? So I know everybody thinks sometimes library instructions are kind of extras in everything they have to do, and they may be, but in this case, you're here to learn about researching because it has become part of the nursing profession. And I'll tell you a little bit why that has happened. Evidence-based practice, what we're talking about today, is basically how do you know what to do at the clinical site, and how do you incorporate research into doing that? Well, what happened historically, and this is a Canadian study that was done in the late 80s. So what happened was they did this huge study of 18,000 nurses in Canada, and they asked them when they're in the hospital room and they're treating, say, your grandma Louise, how do they decide how to take care of her? And they came up with 16 or 17 various points of how you make decisions about how you're treating your patient in the bed or taking care of them. And the thing that came in first for these 18,000 nurses, which on average had 18 years of experience. So the things that came in top were observation of the patient, which makes sense. Personal experience, we all operate on that, on trying to decide from other experiences with other patients. Lessons from nursing school, I thought this was a real testament to what you're learning now. Conferences and in-service workshops where you're staying up to date. Policies and procedures, like at Heritage Valley, there are certain procedural cares that you follow. And fellow nurses, of course, we consult with each other. We have wisdom that we share. So all these were things that didn't surprise anyone when they did the study. But the last 3 of those 16 or 17 items were medical journals, which may not be too surprising because they were always geared more toward doctors. But nurses have their own journals and studies about caring for patients. So that was second to last in this study. So that was kind of an indication of nurses are doing things the way they were always done. And so this study was showing something. Now, what came in very last are popular magazines, and we're very happy about that because we don't want Nana's Nurse to refer to Field and Stream or Rolling Stone. So, but these 2 things were alarming. And nowadays, they still believe that there is a gap between practice and evidence. So we want to make sure that when you're out dealing with patients that you're incorporating, and in fact, it is your responsibility. And this is something you'll have on your nursing boards and exams, learning the research component. We'll talk about that in a minute. But evidence-based practice is a framework for clinical practice that incorporates the best available evidence, scientific evidence, and the expertise of the clinician and the patient's preferences. So it just makes sense. We're using research with your expertise and then what the patient's needs and preferences are. So this semester, you will have an assignment to sleuth out a study that could be used with one of the patients that you might have in mind. And when you look at evidence-based practice, you're starting out by asking a question, and then you go out and you research the databases, which I'll show you where to go in the second part of what we're talking about today. You look for that research to support the clinical question that you have about your patients. Then when you find all these research studies, you look at them very carefully to see how valid they are. And then you see if that new evidence, that new highly credible evidence can be used with the clinical expertise in your patient in the bed to have a better experience or better outcome. And once you use studies, you're also obligated to follow up with that and see if some of this evidence does really result in better care. So, nursing research is best used for these certain questions that are considered answerable. So those are intervention questions, like the examples here. Intervention, prognosis, prevention, and I have examples for all these. So these are the kind of questions that you want to ask when you're looking for help. Now, the other thing you want to do is learn a very special way of researching these called PICO. And I'm sure most of you have heard of PICO questions, but what that does is it starts with some very specific elements: population, intervention, comparison intervention, outcome, and time. And I can give you an example here. So in hospitalized adults, how does a rapid response team compared with no rapid response team affect the number of cardiac arrests and unplanned admissions in the ICU? And then we're going to see what the population is. Okay, hospitalized adults intervention, rapid response team, comparison, no rapid response team,